This video is going to be about the anatomy of the humerus. Your upper arm is only made out of one bone, and that is the humerus. So this is just a picture of a right humerus. This one is the anterior view, and then this one is the posterior view. But this is all just a right humerus. Right here is the humeral head, and that's what articulates with the scapula to make it the shoulder joint. So right here is like basically the anatomic neck. Right here is the greater tubercle. This right here is a groove called the intertubercular or bicipital groove, and then it separates the greater tubercle from the lesser tubercle, which is like this bump right here. So it's kind of hard to see. Right here is called the surgical neck, and this is basically where a lot of fractures happen. So there's the deltoid tuberosity, and then we have the shaft of the humerus. We have the lateral epicondyle, and then we also have the medial epicondyle. So the lateral is kind of like not sloped as much. The medial is kind of sharp and pointy. That's how you can kind of tell. This entire like section right here is what we would be considered the condyle of the humerus. We don't call this just the condyle. Each of these little things have their own special name. So I always kind of wondered why this was called an epicondyle instead of just a condyle. But basically a condyle is where it's actually articulating. Right here is the capitulum, and it articulates with the radial head. Right here is the trochlea, and it articulates with the coronoid process of the ulna. There is a coronoid fossa right here, and then when you bend your elbow, this coronoid process kind of gets into the coronoid fossa when you bend your elbow. There's a little radial fossa, and that's what kind of receives the radial head when your elbow is flexed. In the back of your arm, you have the olecranon fossa right here, that little indentation. Basically, when you straighten your arm, the olecranon process, it kind of goes into the olecranon fossa. Thank you for watching.